Hi, my name is Charles Quang. I'm a chiropractor and I love to help people. My office is designed to actually help people who actually can't come to the office. There's actually a lot of people we found out that have this particular problem, CSR. CSR is short for central serous retinopathy. The vision is actually affected and eye doctors can't do anything about it. They can't do surgery yet. They don't want to do laser. They actually can't give you any medications. Steroids make it worse. So the common treatments that doctors have will actually make the problem worse. So the doctor's solution is do nothing and wait. If your CSR gets really bad, they're going to offer you the laser treatment. They're going to offer you some kind of a surgery. And there's a way to avoid all that. And what's happening in central serous retinopathy, CSR, is here's your eye. Here's your cornea. Light goes through here. Here's the retina. And in CSR, there's actually a bubble. The retina bubbled up, which means that when the light comes through, it's going to hit the bubble, and the alignment of the eye with the light is off. The cornea aligns the light, focuses it to the backside. If your retina bubbles, then you have a problem. You ever seen somebody who tints a window of a car? A good tint means the entire glass is uniform. A bad tint is there's bubbles, which means the plastic tint did not stick to the glass. And you can see the bubbles on the tint. And that's what's happening here. There's a bubble of your retina. If you add steroid to it, the bubble gets bigger. If you do laser, what the laser does, it welds the edges. So you're going to lose that part of the vision anyways. The laser treatment is only if the CSR is spreading and it's getting worse. So the doctor has no other choice but to sacrifice that piece of the retina so that the bubble doesn't spread to the other retina. The interesting thing about this situation is it's people who have tried an alternative method has actually seen results. CSR is really just the surface of the outside the eye, and you have the inside the eye, which is the retina. There's your bubble, and that bubble is caused by circulation going in, circulation going out. There's either too much circulation going in or not enough circulation going out, and that's CSR. There is an imbalance of circulation behind the retina. And so there's extra fluid that accumulates and pushes the retina out. And that's your extra fluid. So when you have extra fluid, it's going to push that retina. The first step of CSR is we have to unblock circulation. Unblocking circulation for CSR means fluid going in or out, there's a block flow. Something's not allowing that flow to be normal. Step 2 is we're going to increase circulation. We have to increase circulation because we're going to have to drain it at the end. And there's no pump here, like the heart. A heart pumps fluid, and it squeezes the blood to force the blood through our body. And that's how we get blood pressure. We have a high blood pressure and a low blood pressure. That's from the heart. There's no heart here. So what we're going to have to do is we're going to have to use an idea that requires an inflow which leads to outflow. Okay? And that's actually how water flows through a river. That's how water flows up a tree. That's how actually water flows without a pump. So in CSR, without a pump, we actually have to increase the circulation first. And in that case, those who actually have a problem with not enough circulation, they can see that the CSR gets a little bulged out more. And the CSR does appear to get worse. And it just has to happen because there's not enough pressure in there to drain the fluid. So we have to increase the fluid first. Once we do that, we can actually drain fluid. With actual pressure now inside here, we can actually drain what's going on inside the eye, and that fluid is going to drain. There's 2 steps for it. Step 1, step 2. Okay. Usually people get a lot of changes here. They get very happy, and this just makes sure it stays that way. Okay. So this just drains fluid, and that's when most people are happy. Before this step, most people are not happy because no one wants to see their CSR get worse on a program. But in order to do this, we actually had to increase the fluid flow into the pocket, create enough pressure now that the fluid can drain. And then we drain the fluid again some more. Okay. The last step is actually balancing the inflow with the outflow. So you can see there's incrementally, we're increasing the steps of fixing this problem. Because once this problem is fixed, you actually have a peace of mind that it's fixed. You'll be happy, your doctor will be amazed, and then you could walk around not have the fear of CSR. Now there are times when people actually have other health problems that are leading to a CSR situation. Those are health problems that are related to inflammation and poor circulation, and those problems now lead to CSR. To fix CSR in those individuals, we actually had to fix the other problems first before we could see any changes here with CSR. I know it's frustrating to see your eye deteriorate worse and worse and worse, but it's much, much better than doing nothing and waiting for this problem to get worse. And then when that happens, you get offered now a laser treatment, which actually stops the bubble from getting bigger, but it actually doesn't fix the bubble. And when you do a laser treatment, the chances of that bubble recovering goes down, because now you have introduced scar tissue. The circulation now has gone worse, and whatever is causing the CSR here, it might cause CSR somewhere else. So that's why it's important to handle this kind of problem very early on. The program is much smoother, much faster for somebody who catches it early than somebody who tries other things first and prolongs this problem. I'm very happy that you are interested in CSR and handling it My office has been very, very interested in helping people recover their bodies naturally and actually restoring their health. Thank you.